Well, again, I'm Carrie Salambrino. I'm the Dean of Health Professions at Warwick Community College. So this presentation is going to go through our credit programs that we have. And I will post my contact information as well as contact information for all of the programs that we have at Warwick. However, please feel free at any time to contact me directly if you have any questions, and I'm very happy to speak with you, meet with you on campus, and then also direct you to the program that you are most interested in. So first, our health professions departments. We have 5 departments. Emergency Medical Services, and Mr. Danny Webster is the EMS department head. Under EMS, we have a paramedic program as well as EMT. Our nursing program is led by Dr. Brenda Mister, and we have basically 2 nursing programs. We have an LPN and an RN, and you can continue on through from the LPN directly into the RN year. We have an occupational therapy assistant program. Mr. Stuart Gibbs is serving as the OTA interim program director, and that program is for going through this program, you will learn how to become an OTA or an occupational therapy assistant who provides support and help to the occupational therapist. We have a physical therapist assistant program, and Dr. William Bales is the department head, and the PTA assists the PT. We also have a radiologic technology program. Mr. Brandon Goslin is the department head. Also in radiologic technology, we have a CAT scan program, and this is a certificate that you can earn after you become a radiologic technologist. So these are the 5 basic departments with programs contained within them at Warwick in our credit health professions division. So some things to keep in mind with any health profession program is they all are limited enrollment, which means that we have more people apply than we have spaces in the program. But do not let that stop you from applying. You should apply, and regardless of your experiences, and give it a chance to at least apply. Depending upon the program determines how competitive the program is. So for instance, our nursing program is the most competitive for entry. However, we do have more than one admission for the year for nursing. So for instance, in nursing, we actually accept students twice a year in the fall and the spring. So there is an application process, and we are in the process of placing the application online to help just make it easier for students. Along with the application process, there are prospective student meetings. So every single program has prospective student meetings for students that are interested in the program. And these prospective student meetings are a requirement to apply. So if you're thinking, gosh, I'm not sure if I want to be a nurse or I want to become a radiologic technologist, I really would like to learn more about both of these programs, you could attend a prospective student meeting for both of these programs. Talk to faculty, ask questions, and see what particular healthcare field is the right fit for you. Because truly, every healthcare field has a particular personality and set of skills that will work, and you have to determine where you fit in healthcare. And there are so many opportunities that you can explore by pursuing a career in healthcare. So besides limited enrollment, meaning you have to apply, there are a certain number of seats. And you might say, well, why is that? We have this need for healthcare professionals. Why are we limiting the number of students who can get in these programs? We really aren't limiting it. It's the number of clinical sites that we have. So every program, the student will go out into clinical sites to practice the skills of the profession. So we need to have sufficient clinical sites for you to do that. And we do go to every hospital that is local in this region. We have students who rotate through areas in Salisbury. Some programs go to Virginia as well, and Delaware. We have many clinical sites that are outpatient offices, urgent care facilities, mental health facilities. So we do have a lot of clinical partners, but all of them limit the number of students that can go into those sites. So that is the reason why we have a limited enrollment health programs. all of our health programs have prerequisites, and that is what Maggie was just talking about. And prerequisites, it's just a fancy word for saying, what are the courses I have to do before applying to these programs? And those prerequisite courses are Anatomy and Physiology 1 and 2, our English 101, which is an English composition course, our Elementary Statistics course, that's the math course, and an Introduction to Psychology course, as well as our SDV Fundamentals of College Study. These are the prerequisite courses that have to be completed before getting into the program for most of the health programs. What this means is you can start taking classes in the fall and think you want to be a nurse, but after attending another prospective student meeting, you might decide, you know what, I really would like to go into physical therapy instead. Those prerequisites are portable, meaning all of the health programs have the same prerequisites. So it's very easy if you're in the health pathway to start in the prerequisites and say, well, I thought I wanted to be a nurse, but now I'm going to go into OTA instead. So you don't waste time and you don't waste money. Those prerequisites can go into any of those programs. Some other things to keep in mind with healthcare is all of our programs require a background check and drug screen. And this is completed at least once, but sometimes more than once when you're in the program. So the majority of programs have this background check and drug screen requirement before entry into the clinical setting. Again, we're caring for real people, and we have to make sure that everyone entering the program is safe and also meets the requirements of our clinical agencies. So Warwick does not require the background check and drug screen. This is the requirement of the clinical agencies, and we are guests in their facilities. So we have to abide by those requirements in order to participate in the clinical setting. Additionally, just because we are dealing with COVID, I just want to bring to everyone's awareness that while the COVID vaccine is not mandatory at Warwick at this time, there are clinical sites that require the vaccine for access. This is not all clinical sites, but it is evolving. So this is something you need to keep in mind. Also, other standard vaccines, such as the flu vaccine, are required to participate into clinic. The other thing to keep in mind with all of our health profession programs is that all of the programs have what we call programmatic accreditation. And this programmatic accreditation is nationally recognized. And this means that all of our programs are watched and monitored to ensure quality of instruction, both inside the classroom, whether that be didactic or theory is what we call it, or laboratory skills, or the clinical setting. So all of our health programs have earned programmatic accreditation, and those standards that are in place through their accrediting agencies have to be applied to make sure that we are giving high quality education to the students of which we serve. So as Maggie was saying, we have a building called Shockley Hall, and in my opinion, this is the very best building on campus. We have amazing things for our students, and if you haven't been here, I'm just so excited for you to have an opportunity to come visit and see all of the wonderful simulation equipment that we offer our students in our health programs. On the first floor is where we hold our nursing simulation labs. We have 3 labs that look very similar to an ICU or a floor that you would see on the hospital, where we have beds that are all through the back of the classroom. These are hospital beds with mannequins. They're set up with oxygen suction, those type of things. We have a birthing room. We have a mannequin that actually gives birth, so our students can participate in that and see what that is like prior to actually experiencing it on a real life person. Also on the first floor, we have a computer lab that is for our health programs. We have an assembly hall, which some of you may have seen if you've been to the college, that we do some presentations in, and classrooms that are used for nursing as well as other programs. On the second floor is our nursing faculty office suite. All of our nursing faculty are housed there. My office is also on the second floor within that suite. We have our occupational therapy assistant lab, with all of the materials that you would find in a therapy unit at the hospital or in an outpatient center. We also have a physical therapist assistant lab, same thing. Everything from the beds, exercise equipment, exercise balls, mats, weights, ultrasound equipment, you name it. If it is used in physical therapy or occupational therapy, we have those items for our students to practice with. Recently, we just purchased babies. They're infants that have articulated joints that can move. And this was something that our department heads thought would be very helpful because they have to do therapy on infants and we can't practice with baby dolls that you would buy at Walmart. These doll babies, we bought 16 of them. They were about $10,000, a big investment, yet very, very intricate to learning how to care for infants and provide therapy to them. So this is just one example of a tool that we have at the college for students. We have a home health lab, and this lab is set up with, it has a bed, a shower, a toilet, a kitchen, a sitting room. And this is used by our therapy programs as well as EMS. So for instance, our EMS students might practice if a patient falls out in the shower and they have to get them out, they need to be able to do that and practice doing that. So they do a lot of scenario practice in the home health lab. The kitchen, they are occupational therapy. If you have a person who has a stroke and they struggle opening a cabinet or opening a can or preparing food for themselves, they would show the patient how to do that by practicing in the lab. We practice safe transfers to and from the bed in that home health lab. We also have nursing classrooms that are also used for other programs on the second floor. On the third floor of Shockley Hall is where we hold our Radiologic Technology classroom with a live x-ray room. So it takes x-rays. We have multiple mannequins, or phantoms is what we call it in x-ray. They have bones inside their bodies. So when you x-ray them, you actually see a radiograph and can look at it and see what anatomy is there, and students can evaluate their positioning skills and their exposure with radiation to our patient and determine if they are doing it correctly. So they're practicing not on each other with the x-ray, but with mannequins. We also have other type of simulation type of equipment in the radiology classroom, such as stretchers and like backboards, so they can simulate with phantoms or mannequins how to do trauma x-ray, where the patient cannot move at all. How do you do the x-ray if your patient can't move? We have the simulation equipment to do that, and we are in the process of getting ready to purchase a portable x-ray machine so they can practice actually doing portable x-rays as we would do in the hospital. Our EMS classroom is equipped with an ambulance that is inside the wall, as well as many types of simulation mannequins where they show the patient's EKG, their heart rate, and then the instructors can change that so that the student would have to say, oh, well, now the heart rhythm is this, and based on that, I need to give these particular drugs. So we do a lot of simulation, a lot of hands-on work, so our students feel comfortable in the clinical setting and out in the field on how to actually care for patients. And then our EMS, OTA, PTA, RDT, faculty, office suites, they are also all held on the third floor of Shockley Hall. So now getting into each of these programs, again, emergency medical services, we have an Associate of Applied Science degree, we have a paramedic certificate, and we have an emergency medical technician path, of which are 2 courses. So there's a lot of options here. If you want to be a paramedic, the very first step is to become an EMT, or emergency medical technician. You may not realize, but this is a very quick set of courses. So EMT is actually completed in 1 semester. There are 2 courses, EMS 101 and 151. They are each 7-week courses. So in those 14 weeks in 1 semester, you can go ahead and learn what you need to become an EMT and then sit for your national registry. At that point, you are ready for employment, whether that be on a Lifestar commercial type ambulance or working for 911 like Salisbury Fire Department, as you see in this slide right here. After you become an EMT, we encourage you to keep going with your education and go ahead and get into the paramedic program. So you can apply for the paramedic program, and that program is 2 years. For EMT, as well as paramedic, you go out in the field. So for EMT, you go on rides and you apply your skills on patients in the field. For paramedic, you are doing what we call team leads. So you get to the field work that you do in the actual 911 ambulances and fire departments. You actually show how you lead these calls and how you manage the scene and how you would call in to the hospital the particular problem that the patient is having. So also some cool things that the paramedic program does. They actually kind of rip open a car and extract people out of cars because that's something they have to do. And those are things that they do on our campus. The EMS, so you can go ahead and get a certificate in paramedic and get to work that way, or you can get the certificate and then come back and finish your degree. There's a lot of opportunities here to work in EMS. So what type of person might want to work in EMS? If you are somebody who likes to be on the run, if you like that high adrenaline, if you are someone who likes to think on your feet and have something new and exciting every day, this is really EMS. In the fire department, you could be a paramedic and not also be a fireman, but in many of them, you also learn how to be a fireman as well. So they rotate through. A lot of them do 24-hour shifts, and they are scheduled on the ambulance or they're scheduled on the fire truck. If you want to learn more about this program, please reach out to Danny Webster. Danny and Chuck Barton are our 2 full-time instructors. We also have multiple part-time instructors in this program, and they have a wealth of knowledge. Mr. Barton was a deputy fire chief at Ocean City Fire Department. He's been with our college for a very long time as a part-time instructor and before he came full-time. And after retiring from Ocean City Fire Department, he is a brilliant man with a wealth of experience. Mr. Webster still practices in the field. He still works at Fruitland, Powellville, Willards as a paramedic, as well as teaching our courses. So very, very experienced faculty, and they would be thrilled to answer any questions that you have about EMS. Again, just reiterating, EMT can be completed in 1 semester, 2 courses in 1 semester. But one thing to just mention, our paramedic program, the application deadline for that program is the last Friday in June, and the program does begin in the fall. For paramedic, we offer a day and an evening program. So depending upon what works best for you, you have a choice of which track you would like to take. Next is our nursing program, and we have a practical nursing certificate. That's the LPN year, that is year 1. And we have an Associate of Science in Nursing. That's the 2nd year, that is the RN. So you can go ahead and complete the 1st year of nursing, sit and take your NCLEX PN exam, that's the national exam to earn your LPN credential, and you can start working in the field. You can start working as an LPN and continue on to obtain your RN. Once you complete the LPN year, you're directly entered into our RN year. So once you pass all of your LPN courses, you go directly into the RN year. You do not have to apply again. Let's say you do your LPN. If somebody did an LPN at another college, we certainly want you to choose Warwick. So we're not going to say any of you are doing it at another college. But if somebody else did their LPN at another college and then decided to get into Warwick's RN program because it's so fabulous, they could come into the RN program through what we call the LPN to ADN pathway. And so that's for people who are LPNs who want to get into our RN program. They would take this LPN to RN bridge course is what we call it. And then they would enter into our ADN, or the associate degree of nursing, last year in the program. Just like EMS, and I don't know if I mentioned the accreditation of EMS, but nursing, of course, is accredited as well through an agency called the NLNCNEA. Dr. Brenda Mister is the department head. All of our nurses our nursing faculty were clinicians first. They all worked in the field. Some still do. Some of them still work in the hospitals or other agencies. And if there was ever a time to become a nurse, it is now, because there is such a huge, humongous need for nurses, not just locally, but across the country. So one of the things to think about with healthcare, there's such enormous potential. And in this day and age where sometimes there's concern when people choose a career path that they could be laid off, that a company could close, let me tell you, you're not going to be laid off if you're in healthcare, okay? And not only will you have opportunities in our region, because we need healthcare professionals of all types and kinds, but you also could elect to become a traveler. So if you're somebody who says, you know, I really want to see the country, I want to go to visit different places, you could be paid top dollar to be in Florida, in Miami, hanging out on your free time and working in healthcare. So again, give some consideration to where do you want to be and what opportunities do you want to have. Healthcare can really give you the life that you're looking for. Again, continuing with nursing, we do have 2 admissions per year. We accept students to start in the fall, and we accept students to start in the spring. So the last Friday in May is for fall admission. The first Friday in November is for spring admission. Again, we have a day and a night program. Lots of outstanding opportunities for people in nursing. Great simulation equipment and assistance on our campus with very capable and wonderful nurses that are our nurse educators. And I'm sure that if you decide on nursing, that you will feel the same way. Our next program to discuss is our Occupational Therapy Assistant program. And Mr. Stuart Gibbs is our interim program director for that program. Our program is nationally accredited through ACOT. And I would say that a lot of people really don't know what occupational therapy is. And if you ever have an opportunity to meet Stuart Gibbs, Mr. Gibbs, he's an amazing person to talk to, but to hear him speak about the profession and to listen to his experiences, he's just had so many different experiences from being in the military and civilian life. His wife is also a physician, so he just has a wealth of knowledge to share. Mr. Gibbs is also accompanied by Ms. Sigmund, who is she is our department head for the program with a wealth of experience also in occupational therapy, and Ms. Karen Holmes, who is a part-time certified nursing assist or certified occupational therapy assistant instructor. So occupational therapy, I use a lot of times an example of if the person had a stroke. So we'll start with that. If a person has a stroke, a lot of times an acute cerebral infarct or stroke, whether that be hemorrhagic, meaning it was a blood vessel that burst in the brain, or ischemic, where a blood clot occluded a vessel or prevented blood flow from going in to a particular area of the brain, causing the brain to die because there was a lack of oxygen. A stroke can have detrimental effects on the body, and oftentimes the person is left with some kind of paralysis on a particular side of the body. So think about the things you do when you wake up in the morning. You brush your teeth, you comb your hair, you take a shower, you put on clothes, you do all of these things and you don't even think about it. Well, if you had a stroke and your left side of your body was weak or numb, or you couldn't move it, how would you dress yourself? How would you take a shower? How would you make a sandwich? Occupational therapy helps people perform normal routine functions and activities of their life. And they show you how you can do that so that you can regain your independence. So they might show you, they might use a particular device or tool so the person can put on their clothes independently, so they can go to the bathroom without assistance. These are the things that make us human. These are the things that make us independent. Another thing they might do, let's say a person has an amputation. Maybe they had their hand amputated, or maybe they had a severe injury that they can't move their fingers. They may need a device to help them open up a cabinet, or how are they going to prepare meals? How are they going to maybe type on a computer or things like that? So they help people by giving them a lot of tools to get them back into normal life and function. So a very outstanding and career path for somebody who really wants to help patients by giving back. So again, occupational therapy assistant it's also limited enrollment. Its application deadline is the last Friday in June, and they have a fall admission. The next program I'd like to discuss is a physical therapist assistant program, and this is led by Dr. William Bales. Dr. Bales and Dr. Cotter-Luz are the two faculty members that are part of the physical therapist assistant program. They are both PTs. Dr. Bales actually owns his own business as well, so he still practices in the field. And Dr. Cotter-Luz, she also still practices in the field as PTs. So physical therapist assistant, they're going to provide support and basically carry out the plan that the physical therapist designs for the patient. So if you've ever had a sports injury, you know firsthand how important physical therapy is. If somebody has a total hip or total hip replacement or total knee replacement, they may need assistance in learning how to walk with that new joint. A lot of times you will see physical therapists and physical therapist assistants working with our veterans where they've had some catastrophic injury while in war, and maybe they have an amputation. You might see somebody who's been in a car accident and they need to learn to walk again or to use a particular part of their body. So the physical therapist assistant is going to help with all of those things. So these are pictures of our classroom, so you can see all of the things that they have at their disposal. This doesn't do it justice by any means. In the one picture, you're seeing ultrasound equipment, but we have a balance system, lots of beds, stretchers, things of that nature for students to actually practice doing the therapies on one another on our campus. So the physical therapist assistant program has a fall admission, and their application deadline is also the last Friday in June. Radiologic Technology, this is close to my heart because I am a radiologic technologist before coming to Warwick. Full-time, I worked in the field as a CAT scan tech, a radiologic technologist in diagnostic imaging, and did several things in terms of leadership, clinical instruction, management at hospitals. But radiologic technology is as X-ray. It's very fun. It's very exciting. If you're somebody who you want to work with people, but you also want to work with technology, you like computers because a lot of things are computer driven. You enjoy working with people, yet you would rather maybe have those interactions be shorter because you'd rather you want to keep moving. You want to have a you want to move from one thing to the other. X-ray definitely can be a great path for you. One of the great things with radiologic technology is once you become a radiologic technologist, there are also many different career paths you can explore with additional certifications. So like I said, we have a CAT scan program or a computed tomography certificate. So you can become an X-ray tech and also go through our CAT scan program and be certified as a CAT scan tech as well. So as you build on your credentials, you also build on your marketability, how easy it is to get a job, it becomes even easier when you can do more than one thing, and also drives up the amount of money that you will make. Your salary will increase as your credentials increase. So students complete our radiologic technology program. They might go into CAT scan, they might go into MRI. We've had students that finish our program and they go into radiation therapy, they go into ultrasound or sonography, go into nuclear medicine. There's go into mammography. So there's a lot of opportunities once you become a radiologic technologist. If you want to learn more about this program, I do encourage you to reach out to Mr. Brandon Goslin. He is our department head. The great thing with our radiologic technology program, I think, is your instructors are graduates from this program, which I think is amazing. So Brandon, Mr. Goslin, he actually was one of my prior students when I was a department head in the role. And he is an outstanding person and a great technologist. He also is certified in CT. And Ms. Cynthia Ross is also a graduate of the program. And many of your instructors that you have, many of your clinical instructors are all Warwick graduates. And for the most part, if you get an x-ray at any hospital in our Tri-County area of Wacomico, Worcester, and Somerset County, or go to an urgent care, your doc's in, Salisbury immediate care, if all the Peninsula Imaging, Peninsula Orthopedics, you're going to find Warwick graduates. We are everywhere. So I just encourage you to explore radiologic technology if you are interested in these type of things. So radiologic technology is very different than the other programs from the point of view that they start in the summer. So the deadline to apply for radiologic technology is the second Friday in May. So this one, you have to be thinking of your application a little bit quicker. What you see on the one picture of this is actually our x-ray lab that is on campus, and they're showing you x-rays of the chest and a lateral knee x-ray. So next steps, you think healthcare is for you? Well, I'm excited because I just don't think there's a better career path. There are so many opportunities in healthcare. It's a way to, one, learn something that is constantly evolving. There's never a dull day in any healthcare field, and you definitely feel very good about giving back and caring for others. So you can't go wrong with choosing any of our professions in healthcare. But the first step absolutely is attend a prospective student meeting. And you can do this now. You can explore these programs right now in your senior year. And all of the dates for the prospective student meetings, at least through the fall, are on our website. Many of them are virtual, so you could fit this in between classes or at the end of the day. So I encourage you to go ahead and attend a prospective student meeting and learn more. We have an admission information packet, and it is located on the web pages of every one of these programs online. Read this. This tells you all about what you need to do, the prerequisites, how we select students to get into the program, how we rank students based upon their scores. So please review that. And if you have any questions whatsoever, let us know. We're so happy to help you. Also, each program has a specific program information packet that gets into more detail about the program itself, the course sequence, the particulars on how long it takes to complete the program, and those kind of things. And as Maggie said, if you attended her presentation first, ask for help. We are here to help you. There is no stupid question. Every question is welcome. And it's so important for you to ask the questions now because you're making some really important decisions for yourself. So ask the questions, get to know our college and information about the programs, and we are all here to help you in doing that. So again, our motto is start here and go anywhere. I say start here and go anywhere in healthcare. The opportunities are endless. There's not a better time to enter healthcare. There are so many job opportunities. Going through our programs, you will get a job. You will be working in the field. And that is so important, that you choose a career that you actually can make money and you can make a good living and have a good life. Okay. Again, this is my contact information. Very happy to help you. You can certainly contact me directly and I can walk you through the process. You can come and meet with me. I'm happy to schedule meetings with you, your parents, groups of students, whatever suits you. I'm more than happy to do that and help you with these next steps. So just here, I think this kind of says it all. I see, I showed you some pictures of our nursing graduates at the top and how they decorated their caps for commencement. Down at the bottom, the person who's holding up the Maryland sign, this was a nursing grad who decided to go to New York and help in New York for the COVID pandemic. And also some pictures of our nursing grads with our Warwick sign. So we truly are changing the lives of our students and all the patients we serve. So again, very excited to help and provide you additional information. If you would like it, I'm happy to be of assistance to you.
Thank you so much. That was really a lot of great information. Wonderful presentation.
You're welcome.
Any questions from our students or parents? What kind of qualities or personal characteristics are you looking for in your students so that it will help them be successful in the medical field?
Sure. First, you really have to want to work with people. If you do not want to work with people, this is just not going to work for you. So you have to want to work with people. Secondly, I think you have to have a good interest in science because everything is science-based that we do. So anatomy and physiology is the core foundation of all of our programs. So you have to have some interest in science and the human body. I think you have to have an open mind because you are going to see things, hear things, smell things, do things that you probably never thought in a million years you would participate in. You have to want to be part of a greater team to give to the greater good of the patient. So for instance, you may be a nurse or an x-ray tech or whoever, but when it comes time at the hospital or clinical facility, if someone needs help, we all help. We are one big team helping to care for the patient. So it's not, well, that's not my job. I worked night shift for many years and I was x-ray, but let me tell you, if I needed something, nurses, physicians were in the x-ray department to help me. I went to the ER if they needed help. I did CPR on patients. I helped when they were giving stitches to patients. You do what you can for the good of the team. So you really have to be a team player. You have to like science, like to problem solve and think critically, because the patient doesn't always know what's wrong with them and it's not always obvious what's wrong with them. So you have to be curious, you have to be inquisitive, you have to be able to ask good questions. And I've had many students through the years that were shy, and that is fine. You don't have to stand up and give a speech. You just have to be a star to that one patient that you're caring for. So even if you're shy and you're like, I'm not somebody who likes to stand up and do this, that's okay. One-on-one, you have to be able to care for that patient and relate to them and their situation. Does anybody else have any questions?
Any other questions for her? If you think of something later on, another day, tonight, tomorrow, you have her contact information, and I know that she would be more than happy to talk to you at another time as well.
Absolutely. And as I said, it's not a problem if you would like to come to campus or meet with me, or your parent wants to come with you. I have met many times with students and parents together, so I have no problem with that either.
students, that sounds like a great invitation. Take her up on it. All right. Well, thank you very much to our Warwick presenters tonight. We really appreciate all of these great options that you have presented to us and to our students and some of the parents that were involved in our sessions tonight. And we hope that they will take advantage of these programs that you're offering in the near future. Thanks so much.